Did you know that heart disease is the leading cause of death worldwide, responsible for over 17 million deaths each year? It's a startling fact that emphasizes the urgent need for awareness about heart health. Hello and welcome to Health Basics, your guide to healthier living. In today's video, we are going to talk about 9 bad habits that are destroying your heart. Your heart is one of the most vital organs in your body, and it works hard to pump blood and oxygen to every cell. However, many of us are not taking good care of our heart, and we are putting ourselves at risk of developing serious and potentially fatal heart problems. In this video, we will reveal the 9 bad habits that you need to break if you want to keep your heart healthy and strong. Make sure you watch till the end, because some of these habits may surprise you. Number 1. Smoking. The first bad habit that can damage your heart is smoking. Smoking is one of the worst things you can do for your heart, as it damages the blood vessels and increases the risk of stroke, heart attack, and other cardiac diseases. According to the American Heart Association, smoking is responsible for nearly 1 in 5 deaths from cardiovascular disease. Smoking also exposes you and those around you to harmful chemicals that can cause cancer, lung disease, and other health problems. If you are a smoker, you need to quit as soon as possible, or at least reduce the number of cigarettes you smoke. There are many resources and programs that can help you quit smoking, such as nicotine patches, gums, lozenges, or counseling. You can also ask your doctor for advice on how to quit smoking. Quitting smoking will not only improve your heart health, but also your overall well-being. Number 2. Sitting all day. Another bad habit that can harm your heart is sitting all day. Sitting for long periods of time can affect your blood pressure and lead to atherosclerosis, the buildup of plaque in the arteries. Atherosclerosis can narrow or block the arteries, which can reduce the blood flow to the heart and cause chest pain, angina, or heart attack. A study published in the Journal of the American College of Cardiology found that sitting for more than 4 hours a day increased the risk of cardiovascular events by 125%. Sitting can also affect your metabolism, weight, and posture, which can further affect your heart health. To avoid the negative effects of sitting, you need to break the sedentary cycle and increase your physical activity throughout the day. You can do this by taking short breaks every hour to stand up, stretch, walk, or do some simple exercises. You can also use a standing desk, a treadmill, or a bike at work or at home. You should aim for at least 150 minutes of moderate-intensity physical activity per week, as recommended by the World Health Organization. Number 3. Eating too much salt. Moving on to the next bad habit, eating too much salt. Salt is an essential mineral that helps regulate the fluid balance and the nerve and muscle function in your body. However, excessive consumption of salt can raise your blood pressure and increase your risk of stroke, heart attack, and coronary artery disease. High blood pressure, also known as hypertension, is a major risk factor for heart disease as it puts extra strain on your heart and damages your arteries. The American Heart Association recommends limiting your sodium intake to no more than 2,300 milligrams per day, which is equivalent to about 1 teaspoon of salt. However, most people consume much more than that, as salt is hidden in many processed and packaged foods such as bread, cheese, sauces, soups, snacks, and fast food. To reduce your sodium intake, you need to read the nutrition labels and choose foods that are low in salt or sodium. You also need to avoid adding salt to your food and use herbs, spices, lemon, vinegar, or other salt-free seasonings instead. By cutting down on salt, you can lower your blood pressure and protect your heart. Number 4. Drinking too much alcohol. The fourth bad habit that can affect your heart is drinking too much alcohol. Alcohol is a substance that can have both positive and negative effects on your heart, depending on how much and how often you drink. Moderate alcohol consumption, which is defined as no more than 1 drink per day for women and 2 drinks per day for men, can have some benefits for your heart, such as raising your good cholesterol, HDL, and preventing blood clots. However, overindulging in alcoholic beverages can have the opposite effect, as it can affect your heart rhythm, blood pressure, and cholesterol levels. Drinking too much alcohol can also lead to weight gain, liver damage, and addiction, which can further harm your heart. Therefore, you need to drink moderately and responsibly and avoid binge drinking, which is consuming more than 4 drinks in 2 hours for women and 5 drinks in 2 hours for men. If you have a history of alcohol abuse or a medical condition that affects your heart, you should avoid alcohol altogether and consult your doctor. Number 5. Eating a high-calorie diet. The 5th bad habit that can harm your heart is eating a high-calorie diet. A diet high in calories and low in essential nutrients can affect your cholesterol, blood sugar, and weight, which are all risk factors for cardiovascular disease. Cholesterol is a waxy substance that is produced by your liver and found in some foods such as eggs, meat, cheese, and butter. Cholesterol is needed for your body to make hormones, vitamin D, and bile acids, which help digest fat. However, too much cholesterol in your blood can cause plaque to form in your arteries, which can block the blood flow to your heart and cause angina, heart attack, or stroke. There are 2 types of cholesterol: low-density lipoprotein, LDL, which is the bad cholesterol that builds up in your arteries, and high-density lipoprotein, HDL, which is the good cholesterol that removes the excess cholesterol from your blood. You want to have low levels of LDL and high levels of HDL to keep your heart healthy. Blood sugar, also known as glucose, is the main source of energy for your cells. However, too much glucose in your blood can damage your blood vessels and nerves, which can lead to diabetes, a condition that affects your body's ability to produce or use insulin, a hormone that regulates your blood sugar. Diabetes can increase your risk of heart disease as it can cause high blood pressure, high cholesterol, and poor circulation. Weight is another factor that can affect your heart health, as being overweight or obese can put extra pressure on your heart and make it work harder to pump blood. Excess weight can also lead to diabetes, high blood pressure, high cholesterol, and sleep apnea, a disorder that causes you to stop breathing during sleep, which can affect your heart rhythm. To prevent these problems, you need to eat a balanced diet that includes fresh fruits and vegetables, whole grains, lean proteins, and healthy fats, such as nuts, seeds, olive oil, and fish. You also need to avoid foods that are high in saturated fat, sodium, and sugar, such as fried foods, processed foods, sweets, and soft drinks. By eating a healthy diet, you can lower your cholesterol, blood sugar, and weight, and improve your heart health. Number 6. Poor stress management. The 6th bad habit that can harm your heart is poor stress management. Stress is a normal and inevitable part of life, and it can have both positive and negative effects on your heart. Positive stress, also known as stress, can motivate you to perform better, overcome challenges, and achieve your goals. Negative stress, also known as distress, can overwhelm you, impair your judgment, and affect your mood. Chronic stress, which is prolonged and excessive negative stress, can have a negative effect on your heart, especially if it is not managed properly. Chronic stress can trigger your body's fight or flight response, which can make your heart beat faster and raise your blood pressure. This can damage your arteries and increase your risk of heart disease. Chronic stress can also affect your immune system, your digestive system, your sleep quality, and your mental health, which can further harm your heart. To cope with stress, you need to practice relaxation techniques such as deep breathing, meditation, yoga, or massage. You also need to identify and avoid the sources of stress or find healthy ways to deal with them. You can also seek support from your friends, family, or a professional therapist. By managing your stress, you can improve your heart health and your overall well-being. Number 7. Lack of sleep. The 7th bad habit that can harm your heart is lack of sleep. Your heart needs plenty of rest to remain healthy and function properly. Lack of sleep can affect your heart function and increase your risk of hypertension, stroke, and heart attack. According to the National Sleep Foundation, adults need about 7 to 9 hours of sleep per night, but many people do not get enough sleep due to various reasons such as work, family, or lifestyle. Lack of sleep can also affect your metabolism, appetite, mood, and concentration, which can lead to weight gain, diabetes, depression, and poor performance. To improve your sleep quality and quantity, you need to follow a regular sleep schedule, avoid caffeine, alcohol, and nicotine before bed, limit your exposure to light and noise, and create a comfortable and relaxing sleeping environment. You can also use some natural remedies, such as chamomile tea, lavender oil, or melatonin supplements, to help you fall asleep faster and sleep better. By getting enough sleep, you can lower your blood pressure, reduce your inflammation, and protect your heart. Number 8. Not getting regular checkups. The 8th bad habit that can harm your heart is not getting regular checkups. Not getting regular checkups can prevent you from detecting and treating any underlying heart conditions that may not cause any symptoms. Many people do not get regular checkups because they think they are healthy, they are busy, they are afraid, or they do not have access to health care. However, regular checkups are essential for your heart health, as they can help you monitor and manage your blood pressure, cholesterol, blood sugar, and other heart-related factors. They can also help you prevent or treat any risk factors such as obesity, diabetes, or smoking. They can also help you diagnose and treat any heart problems such as arrhythmia, valve disease, or congenital defects. You should get your blood pressure checked at least once a year, your cholesterol checked at least every 5 years, your blood sugar checked at least every 3 years, and your electrocardiogram, ECG, checked at least once in your lifetime. You should also get a physical exam and a medical history done by your doctor at least once a year. You should also follow your doctor's recommendations for any tests, medications, or treatments that you may need. By getting regular checkups, you can prevent, detect, and treat any heart problems and improve your heart health. Number 9. Not taking your medications. The last bad habit that we will discuss is not taking your medications. Not taking your medications as prescribed can worsen your heart condition and increase your risk of complications. Many people do not take their medications because they forget, they do not understand, they do not agree, they do not like, or they cannot afford. However, not taking your medications can have serious consequences for your heart health, as they can help control your blood pressure, cholesterol, blood sugar, and other heart-related factors. They can also help prevent or treat any heart problems, such as angina, heart attack, stroke, or heart failure. Therefore, you need to take your medications as prescribed by your doctor, and do not stop, skip, or change your dose without consulting your doctor. You also need to inform your doctor of any side effects, allergies, or interactions that you may experience. You also need to remember to refill your prescriptions and store your medications properly. You can also use some tools such as pillboxes, alarms, calendars, or apps to help you remember to take your medications. By taking your medications, you can improve your heart function, reduce your symptoms, and prevent complications. This brings us to the end of the video. We have discussed 9 bad habits that are destroying your heart and how to break them. We hope you have learned something new and useful from this video. Remember, your heart is your most precious asset, and you need to take good care of it. By making some positive lifestyle changes, you can improve your heart health and live a longer and happier life. Thank you for joining us today on Health Basics. If you found this video informative and valuable, please subscribe to our channel for more insightful health tips and guides. Stay healthy, stay informed, and we'll see you in the next video.